Okay, so you are welcome back to our platform, rafamallgh.com/rafanews. And you know what we do. In fact, anywhere or any place where there's health program, health screening, we are interested, we want to go there and take a full coverage. And as we have told you, we are here at Akropong Mampong. There's an ongoing health screening here, courtesy by Grace Presby Chapel Church. In fact, we have spoken with the minister, and we have the head of the medical team here also here, and want to talk with him and see some of the activities ongoing here. So you're welcome to our platform, Doc.
Thank you.
Please, may we know your name?
I'm Dr. Dzifa Kpesenu.
Nice meeting you, Doc.
Nice meeting you too.
So please, we have seen so many health activities ongoing here. Blood sugar, we have seen thermometer tests and those things. Please, what exactly is going on?
Okay, so as you already know, Grace Presby Akropong is 25 years. And we've been organizing series of activities to mark our anniversary. And in the month of September, we dedicated it as our health month. And we are using a medical outreach or screening to climax that occasion. So that's the purpose for which we are gathered here.
That's great. So what are some of the medical activities ongoing here, and also some of the relevance of some of these particular activities that's going on, like the screening? What are some of the screening that's ongoing here currently?
Okay, so we are screening basically for common conditions like hypertension, diabetes. We are also looking at anemia, and we are looking at HIV/AIDS. Then we are doing some eye screening, looking at the ear, nose and throat, whether there are issues. Then we are also doing breast examination for young women and old women who are interested to screen for early breast cancer. So that's what we basically are doing. And we're also taking the opportunity to raise some blood for the blood bank in Tetteh Memorial Hospital. So as you can see, there is a blood donation stand, and I think the activities are yet to commence.
That's great. And Doc, tell us why the purpose of screening. Why should we take screening very, very important?
Okay, so as we know, when we screen, we pick early disease without symptoms. And sometimes when we pick them early, we can intervene or recommend some form of lifestyle changes so that if it can be reversed, it is reversed. And so, for instance, if we screen for hypertension and we get them early, we can start them with their lifestyle modification, their alcohol and smoking cessation protocol. Then we can also advise them as to what really would bring their pressures up. And if there is a need, we start early treatment so that you don't have the complications of severe hypertension. So that's the purpose of screening.
Thank you, Doctor. I know you are very busy, but our last question, and we let you go. Currently, there's an upsurge of diabetes and hypertension here in the country in Africa. Tell us as to maybe some of the lifestyle activities, or what is bringing out some of these upsurge in increase of hypertension, diabetes in the country, and what are some of the things that we can do to also bring these numbers down?
So yes, many people say that these diseases are white man's disease, and truly so, because most of the time we attribute it to, let's say, a plush lifestyle, the food that we eat, indulging in all sorts of vices like smoking, alcohol, which for most African nations seems to be very foreign. However, we should understand that the world has changed and the world has become a very small place. We keep learning from other people, and for that matter, we must also understand that it comes with diseases that are associated with lifestyle. So basically, for hypertension, diabetes, which we term as non-communicable disease or non-infectious diseases, are really associated with the lifestyle we have lived. over a period of time. So most of the time they say life begins at 40, but indeed these are the times where we see most of these illness, because a lot of people would have entered into the rat race, trying to survive, not having enough sleep, worrying a lot and all sort of things, and some would want to even use alcohol and all that to sort of wind down, and all these things have implications onto their future health. So in effect, the reason why we are seeing a lot of cases of hypertension and diabetes is simply the lifestyle we are living. And I recommend that all of us will take our health into our hands. Know that you are what you eat, and food is also to a large extent medicine, and it also can be poison. And so if you know that this is good for you and can prevent you from getting it, then you stay from it. A lot of fatty meals, a lot of high carbohydrate meals, and a lot of food that are spicy, they are all attributed to problems, not just hypertension and diabetes, and even sometimes cancers. So I would advise all of us that we should inculcate the habit of having a portion of fruits and vegetables on our meals. We reduce our carbohydrates portions, then we'll have all the other essential elements in our diet. Then we take exercising and resting very, very serious. So I think on a nutshell, that's what I can say for now.
Thank you, Doctor, and your whole team. Want to thank you and commend you for your great work that you are doing for these people and the community. Thank you so much, Doc.
Thank you.
Nice having you. Okay.